So the hospital's reaching an interesting stage. The first thing to say is that nothing yet has gone wrong. Touch wood, it will. In the course of the next few years, things will go wrong. But so far, so good. There are 5 stages of planning because hospitals are complicated things, and we are just getting near the end of stage 2. The first 2 stages of planning are called master site planning, and the master site plan has been put into the public arena. The second phase is called concept design, and there's a consortium of architects from Brisbane and Wellington and with a bit of help from London who've been doing those 2 stages of design, and they are the second one is now getting close to completion. And as that happens, the hospital begins to take shape, and we will soon be able to understand quite where the blocks fit together and quite, the so-called blocking and stacking, and which thing will be in each building and how many stories it'll be and how they'll be joined and which will be adjacent and which won't. And we will have at that stage a pretty good idea of what the final product will look like. But the third stage of planning is called preliminary design. So that gives you a sense that no matter how much trouble and effort you go to, in the first 2 stages, there's the second stage. The third stage is called preliminary design, and that'll begin in November. So that's what design has happening with design, and as well as that, there's a bunch of drilling going on because we continue to try and better understand what's going on underneath the hospital. And generally speaking, the ground underneath the hospital is bad. It's not solid. You have to go down a long way to get rock, but it's evenly bad. And being evenly bad is better than being unevenly bad. So that's a summary of where that's at. The next thing to be decided is quite when might we involve ourselves in getting the building contractors on site or on side, because there's a case for saying that you should design the hospital and then build it, but there's probably a stronger case that says you should know your contractor before you're very far into the design, so that the contractor can say, oh really, are you serious about doing it this way? Why don't you do it that way? And you end up with, if you like, more heads on the job. So the early contractor engagement is entirely possible. Certainly the market wants that. We've had some meetings and asked the market, the main contractors and the subcontractors. We've had 2 meetings in Dunedin, and all of the main contractors in New Zealand turned up to one of the meetings, and a lot of contractors, especially from subcontractors, especially from Dunedin and elsewhere in the South Island, turned up to the second meeting, and they all said, we want early contractor engagement. We did the same thing in Sydney a few days later, and all the Australian main contractors turned up and they said the same thing. So we think that we might, well, they nearly all said the same thing. 1 or 2 held a different view, but we think we might well go down an early contractor engagement sort of a role. And so these things don't matter to the public as a whole, and you can build a hospital by lots of different means, but these are kind of important decisions because once they're taken, they're irrevocable, and that's the story of the hospital, is that bits and pieces are coming together. As well as that, there's lots of work being done around consenting. There's still some land to buy. There's still chapters to be written for the detailed business case to go to Cabinet in the first few months of next year. And there's still a lot of things going on. There's been, for example, this morning, a group of people from Dunedin, Wellington and Auckland have been meeting to progress the issue of how do we get the workforce trained, how do we train up more people to try and get this hospital built, and what is the detail around that. It just doesn't stop. The level of detail that's needed to put it together is quite considerable. let me stop there, and thank you for hearing it, and you guys can say, you can make whatever comment or ask whatever question you wish, as far as I'm concerned. Thank you. Now, there's some things that we need to sort out that have not been sorted out. One of them is that the green building standard is derived from Australia, and we need to satisfy ourselves that it has been appropriately amended. To give you an example, Australia is a semi-arid nation, we are not. Our attention to stormwater retention, for example, might be less than. Australia is a warm nation. Dunedin is not, it's a cool climate. So we would want to have probably even higher standards for let's call it insulation, though we would still need some energy efficient cooling services in Dunedin. So there are little differences between Australia and Dunedin that the Building Council thinks they have sorted out, and we're saying we think you probably have, but we're just keeping our powder dry on that. We've got to think about building an environmentally sustainable thing, but something that is also conducive to healing or health improvement in general. And that's kind of, so it's quite a mixed answer I've given you, but I do hope your questioner will understand that we sure as hell get the issue. So there is a crèche in the current hospital, and the crèche is a very successful thing. So much so that there's now a crèche also for people there's not many of them, but there are people working up at Rockery. There's a crèche, there are crèche facilities there. And I've said no, as you asked a question, I said no. And the reason that I said no is that it's outside of scope. Let me explain. We are building a hospital that does this, does that, but doesn't do the other. It doesn't do oncology. It doesn't do mental health. It doesn't do accommodation of university professors. It doesn't do crèche. It doesn't mean that those things can't happen, but it does mean that they won't happen within the budget that I'm responsible for. So in practice what that means is that it's for the DHB to sort out. So the DHB will need to interact with its staff, and I've interacted with them, and the people who, the medical and nursing staff who are associated with the hospital are pretty firm about the need for a good hospital, but also one that's not a good crèche, but one that's not far away. We've got, there are several people who are working on it. We've started buying in support from elsewhere. We've got quite an interesting consultant who's from Perth, actually, Perth, Australia. And he's doing good work right at the moment. And then we will build that thing as time goes by. But please remember that when one is building a hospital, it's the fibre optics and the Wi-Fi, and the first building will be open. First part of the first building will be open in November 2023, and by then, it's 4 or 5 years from now. By then, we will have to have a good idea of what digital services will be in the new building that are not in the current one. And we will have to have begun training people for those new applications. So I'm hoping to find out a bit more about that tomorrow, and right now I don't have enough information, but I want them to have gotten into town and gone out. That would be my ideal. And it should be their ideal, because if we're competing, then Labour will go up and we'll fight for it. And I just think that we will not get fantastic coordination, but because we know what the university wants to do, what the central Invercargill project wants to do, what the Polytech wants to do here, what the city wants to do here, what might be going on in Queenstown. We have a degree of coordination that in Auckland is simply impossible. And so if ACC wants to come along and build a building, I mean, the fact that it's got 500, a good-looking building that will house 500 people means that it's reasonably big, but it'll be a reasonably simple building. It'll be an office block. And so I think I need to better understand their needs and their timing. The thing in the paper the other day had a lot of uncertainty, so I suspect they don't yet know. The two main services outside scope are oncology and mental health. I mentioned a crèche. I said professorial offices. They are part of the existing hospital, but the university does not want them to be part of the new hospital, so it's their choice. And the university will be making its own plans to build buildings nearby the new hospital, and that's for them to talk about. Those are the main things I would say were out of scope. My understanding is that there'll be some consultation on some options, roading options regarding the temporary closure of St Andrew Street, the permanent closure of St Andrew Street, or the permanent calming of St Andrew Street, or whatever. Those various options, as well as what might happen with the one-way system and whether or not the one-way system north ought to be quietened in some way, or various other options that are around. I think the city and the New Zealand Transport Agency will begin consultation on that late-ish this year.
So that's consultation with
public. Yeah. Right. So we should see some options in the newspaper and maps and stuff. And everyone will go crazy because we're all experts on transport. We all want this or that. So there are interfaith facilities now, and there will be interfaith facilities in the new building. I can't remember the detail. I think there was some argument about how flexible they were. I'm looking for some advice over here. I think there was some argument about how flexible the new facilities were, and whether the one room could be made into two at certain times, or two into one. And they are determinedly interfaith, so they're available for Christians, but there's plenty of non-Christian religions in town, and it's important that we accommodate that. So we don't call it a chapel, because it's sort of a Christian name. Interfaith space is probably a good neutral name. And then there's people who might use that space who don't have a religion, or who might have a strong spirituality that isn't part of a formal religion or whatever. So on it goes, people are endlessly different. Well, I think it would be good for me to say, through you, thank you to those people for their time, because they read, they travel, and they attend a meeting. And it can soak up quite a lot of energy.
Yes.
So, I mean, it is a great opportunity, and you can feel privileged to be involved, but it's also good to say thank you.